Excellent, merci beaucoup. Est-ce qu'il y a des questions qui peuvent survenir suite à cette belle présentation? C'est qu'elle a été très claire, très limpide. J'ai vu beaucoup d'intérêt lors de cette présentation. Alors, merci beaucoup, Dr Sarah. Sans plus tarder, maintenant, on va passer à un autre sujet, qui est un traitement d'actualité qui fait poser beaucoup de questions. Ce sont les traitements, je parle des traitements endodermiques. Donc, on en parle de plus en plus, avec que ce soit des radiofréquences ou avec des lasers. Quel type de laser, celui-là ou celui ou cet autre. Donc, pour répondre à toutes ces questions, j'ai invité Dr Montserrat Ponga, qui nous vient d'Espagne, et qui va nous expliquer ces techniques en lipolyse. Voilà, merci beaucoup. Donc voilà, je donne la parole.
Salam alaikum. Bonjour. Good morning. Buenos días. I will talk in English because my knowledge about French doesn't exist. Sorry. Well, I'm so grateful to be here with you, sharing my knowledge about this amazing technique called endotight. Well, oh, sorry, I'm so nervous.
This one.
Okay. 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 We know the advantage to use ND-jack wavelength for this technique because it's very, very safety, because we have an homogeneous heating near the tip and very, very low scattering compared with other wavelengths. For this reason, it reduces the burn risk, and we have an hemostatic action and less bruising and very good light diffusion on the subcutaneous tissue, this wavelength. Okay, these are the reason. This is the reason why I use ND-jack wavelength, because the largest heated volume on subcutaneous tissue and the smallest undesirable thermal effects on neighboring dermal tissue. I like so much this study from Professor Zdenko about the in which he demonstrates the efficacy and safety of the ND-jack laser, because we could, I don't know if, no, oh sorry. We can see in the third photograph the diffusion of the thermal increase to V1 to V2 areas and the security of neighboring tissues. Okay, which are the main advantages of endotight treatment? Of course, we can do this treatment in our offices, performed by under local anesthesia in only one session, with a very, very short recovery period, with no scars, and we can obtain not only skin tightening, not only fat reduction, but we could improve the skin quality because we reduce the size of pores, the wrinkles, the redness, and of course the luminosity of the superficial skin. The patient selection, of course, we must keep in mind the ideal patient, but we have real patient, and the most times we don't have an ideal patient. We have a real patient. The best option are the people who are in grades 1 to 3 scale, Glogo scale, with medium to moderate facial flexibility, with a not excessive skin thickness, or, at the other hand, atrophic skin. Of course, without contraindication for laser therapy and no under anticoagulant treatment or active infection. We need optical fiber, 600 microns, sterile material, local anesthetic, and I always do prophylactic antibiotic coverage. I use this modified clean solution. The only one point I change nowadays is the use tranexamic acid instead bicarbonate. Why? Because the equilibrium on the pH of the solution is the same with tranexamic acid, and the tranexamic acid makes an coagulant effect to avoid the bruising. The entry points always more or less are the same, using the retaining ligament of the face, one of them behind the zygomatic suture, the other one over the gonion, and the third one in the middle of the submental area. Usually, sometimes I use 2 additional entry points, one in the middle of the jaw because it's a very safety area, and the other one in the part lateral to the medial line to try to treat the suborbicular area and to pull up the medial fat compartment. But always use these three entry points. The only part we must to keep in our minds are very risky are the marionette line, which are the most common exit of the marginal band of facial nerve. Okay? Talking about the parameters, this is only an idea, because depending on, of course, the tissue of the patient. More or less, a medium parameter is 10 to 12 watts with a speed of 50 hertz. This is more or less the medium parameter I use. A short video, because we could the opportunity to see the technique directly this evening. I introduced my optical fiber for the entry point, and I move my fiber very, very, very slowly, because we need heat to promote the stimulation of the tissue and to destroy the fat in case our patient has it. Very, very slowly to increase the temperature, because the temperature is is responsible of the effect. Of course, when you have experience, you feel in your under your hand, the other hand, you feel the temperature. But in the beginning, we don't know exactly which is the temperature we are deposit in our tissue. For this reason, when I began to do this technique, I used a thermal camera to be sure that I obtain the correct temperature, which is to 43 to 46 degrees, because it's the temperature we need to induce the collagen, the new collagenesis, and to destroy the adipocytes. I think I will show you the thermal camera with these numbers of temperature. Well, you can see the movement is very, very slow. It's very, very gentle. It's very, very gentle technique. You can see the changes of the light when the temperature is increased, because the light is more luminosity, and in the video we can't hear the sound, but when you are making the movement, you can hear like a popcorn. You can hear, and you are sure you are in a good plane and a good temperature. You can see how I'm going to the exit point, the temperature go down, and when we move the fiber to the point we are treating, the temperature go up. Okay, this is the technique. And a little bit of results. It is important to keep in mind the time the time we need to obtain the results. This is a not immediate results technique. You can see between those photographs are 7 months. This is a very impressive case, in my opinion, because she needs a surgical cervicoplastia, but she doesn't want to do it. And I offer this technique, and this was the result. You can see another hand, and I like so much this video to see the result. It's amazing. She is very happy. Me too. Okay, another case in a very, very young girl with no fillers for Hilton. Sorry. The other hand. Another young woman, 4 months after, 2 months after the treatment. 4. The other hand. You can see with these red lines the elevated of the tissue without lipolysis, only with endotight technique. The increase of the volume on her cheeks cheeks. Yeah, no cheeks. Only for the pull up the tissue. Another case in a male patient, you can see the difference in 3 months without lipolysis, without lipoaspiration, sorry. Okay, you can see the elevation of the tissue. This case is not spectacular, talking about the lifting, talking about and the tightening. But I want to show it because of the treatment of the redness. Okay, we are working with an ND-JAK wavelength, so the improve of the redness, we must to keep in mind. Okay, of course the tightening is present, but in my opinion, is the change of the quality of the skin and the remove of the abnormal vessels are better than the tightening effect. Only one picture to see the results on arms. I love this treatment for arms. And of course, it's mandatory to talk about the side effects. I put only a little bit list of side effects more common in my practice, and the other colleagues share with me their side effects. Of course, hematoma and edema is not a side effect, it's a thermal effect. But during a little bit days after the treatment, and the recovery is complete, of course. The second one is the subcutaneous fat tissue. I show 2 types of subcutaneous fat necrosis. One immediate, it goes because we move our fiber in an incorrect way, and we pass through the skin and destroy the superficial tissue. And the other one is delayed. It appears 2 to 3 days after the treatment, and it causes by accumulate too much heat in the same area. Okay? How to treat? At the same way we treat all of the burn scars, but my assessment is always use prophylactic antibiotic covered as previously to the treatment, and to use ice after the treatment. Okay. Another one is the hemiparesia for the denervation of the marginal bone, who promote a hemiparesia of the DAO. It's a very uncommon secondary effect, but it's very antisocial, okay? Because when the patient talks or lie or smiles, sorry, the lips go down. There is no effective treatment because the corticosteroids doesn't affect, and in my experience, the only one treatment which we could improve the recovery is the use of vitamin B complex to take food to the perineural of nerve. Okay. I show 2 times these side effects. A persistent erythema or acneiform reaction, and its directly relationship with the inflammation is the only one. And the other one I show only 1 time is the inflammation of submandibular salivary glands. You can see you can see in the ultrasound images the gland inflammation because of the heat. In this case, I consulted with maxillary surgeon, and he told me I need antibiotic and corticoid very high doses, and in 1 week these side effects was recovered totally. What is the prevention? The prevention is to have to know exactly how our technology, which is sorry, I don't how is the function of our machine, how works, thank you so much, how works the wavelength we are using. Of course, have a very high knowledge about the anatomy, be so careful with our hand movement, and to be very focused on the treatment of our patient. We are doctors. We have our hands, our eyes, and our mind into the treatment. Of course, to have a very, very near the follow-up of our patient, day by day, by phone, by picture, in our office, day by day, until we are very confident of this technique. Okay? Thank you so much for your attention. Sorry with the language.
No, don't worry. No, it was very good. Je pense que beaucoup de personnes ont aimé la présentation. Je pense que tout le monde a bien suivi ce que vous avez fait. Stay with us because we might have some questions. Yes, you have? You have 2 questions. Okay, I will start with Dr. Zdenko and then Dr. Heinrich.
Thank you, this was great. I have a question about the case with the redness on the face. Did you do just endotight, or you do also from the outside with NDIAG treatment of vascularity?
In that case, only
endotight.
endotight.
So from inside?
Only one side,
you
yes, only one session of endotight.
Great, thank you.
Yes.
Hello, I got 2 or 3 questions, but do you usually do combined treatment in the same session or not? I mean, if you do like endotight, it's the same session, can you do a peel or something like this on that?
Yeah, depending on the patient, I do different treatment at the same time. Of course, PRP is my favorite treatment to mix at the same session, because PRP helps to be more be faster the recovery time. Okay, and the autologous exosomes I use too for this with this objective. Sometimes I use fractate immediately after the treatment to improve the results over the skin if my patient, for example, has, I don't know, scars or very, very deep wrinkles, okay? And my favorite treatment is in a second time, 1 month to 6 weeks after the endotight treatment. I love to use T-runner to improve the results of tightening.
Not in the same session. You let like 6
No,
weeks.
no, because with T-runner you are increase the temperature and you are increase the risk of edema and to make long the recovery period for the thermal effect.
And in boys, when you do endotight, you don't have problems. They lose the hair.
Yes. You must to advertise your patient. They could lose hair. Yesterday I was talking with my colleague, Dr. Hulud. In my country, in Spain, to lose the barb is an advantage. Maybe here not. They must know they can lose hair because we are working with NDJAK wavelength. And a little bit thing very, very important, talking about the male patient, if they save the hair, the barb, it is important to wait 1 week to begin to save the barb, because with the moment, with the movement of the razor, you can promote, unfortunately, the infection of the area if you put a lot of heat in this area. It's clear, the explanation?
Last question for the endotight for the face. You got good results when you have heavy faces?
Yes, but in that cases, you need to put more quantity of energy and you must move your fiber in 2 planes. In the deep plane of subcutaneous tissue are in the superficial plane of subcutaneous tissue, because you need make like tirante. I don't know how to say tirante. Yes, to make a good lift. Sometimes you need to mix with other technique. In my case, I use threads to improve the results of tightening when I have a very, very heavy skin. Okay.
Thank you very much.
Thank you.
Merci beaucoup. Thank you very much. It was perfect. Alors, comme c'est un traitement qui aujourd'hui, il y a beaucoup d'interrogations dessus, j'ai tenu à ce qu'on parle aussi des contre-indications et des dangers de cette technique afin de mieux la maîtriser. Après, maintenant, okay, she will ask a question in French and then I will translate and then we'll move on to the next topic.
Pour le drainage lymphatique et aussi pour le port de bandage après la séance, est-ce que c'est bien?
Yes, concerning the immediate post-act treatment, do you use a bandage or the lymphatic drainage, something like this?
Okay, in the protocol, we use elastic compressive mentonniere, you know, okay? But in my experience, the best option is the ice to minimize the duration of the inflammation, because the inflammation is for the heat, is because of the heat. We put ice over the mentonniere during 48 hours all the day, and in 2-3 days the edema go down practically completely. Okay, it's very, very important in my experience. It's more important than the elastic compression, because if you have a patient who has only sagginess, who has a very thin tissue, like me, for example, you can do a very, very good tight without any recovery period. Only 2 days with ice and is list. Okay?